Well, good afternoon, everybody. This is Tom Rendon.
Sorry, Tom. Let me just introduce you really quick so everyone can know who
Oh,
you are.
okay. No
Sorry.
problem.
He's excited to present.
Yeah,
So
I'm just jumping the gun here. It's crazy.
thanks once again for joining us. It is the fourth webinar in our RTI and Early Childhood webinar series. My name is Christina Davis. I am the Marketing Manager for Early Childhood Books at Books Publishing. In today's webinar, Tom Rendon you'll learn about the importance of collaboration among various early childhood systems and settings in order to ensure successful implementation of response to intervention. So Tom, as you know, is with us today to present the webinar and share his expertise in the area of interagency collaboration. And Tom has been the Iowa Head Start State Collaboration Office Coordinator since 2003, where his priority in this role is to address collaboration with early childhood special education. He's previously served on the governing board of the National Association for the Education of Young Children, among other leadership positions in the early childhood field. Tom is pursuing his doctoral degree in early childhood special education at Kent State University. So now I'm going to turn it over to you, Tom, so that our audience can learn best practices for effective implementation and delivery of RTI among all settings. So you
Well,
can take
thanks,
it away.
Christina. Thank you very much. Good afternoon, everybody. I'm really happy to be a part of this webinar series and really grateful to Brooks Publishing for setting it up and to all of you for participating. What I want to do for a couple of is to provide a couple of thoughts for the next 30 minutes or so, and then we're going to open it up for questions. And as was mentioned, I do work for the Iowa Department of Education, but I probably need to say that these opinions I'm expressing are not necessarily represent the department, but I certainly will own them. You know, after the theory and research, which I think is covered really well in the Handbook for Response to Intervention in Early Childhood, the editors, Virginia Bicey and Ellen Peisner-Feinberg, who I think did an earlier webinar, you know, they really did a remarkable job, I think, of getting to get a compilation of chapters from a wide variety of folks to really ground, I think, even a relative beginner in the foundational points of response to intervention, or RTI, covering all the important topics of assessment, instruction, program level supports. And so that way, I think it really is a handbook in the truest sense of the word. Like those car manuals, you know, you have to buy when you want to repair the car. So something you may want to have along the way. Well, Jim Lesko and I were fortunate enough to have the opportunity to weigh in with our opinions about statewide structures and what all of this might mean from a state standpoint. So this is really getting to the more practical side of the conversation, where we talk about how statewide early childhood systems can be engaged to support statewide RTI efforts. So our chapter is really about state structures and supports, and I think, as Christina mentioned, about collaboration that's necessary to implement an effective RTI system. Now, of course, it can happen that that can happen, and in fact should happen, at a building, program, or district level. But at the state level, one can think about policies and systems that can effectively operationalize RTI. So since writing about this, my own state of Iowa has actually launched such a system, and that experience has given me a lot of additional experiences that I hope I can provide some real-life examples when what that might actually look at. Though I should warn you that we're very early into this process to even think about what lessons we have learned or are learning. And after all, you wouldn't want to ask, you know, Christopher Columbus about what he had to teach you about global navigation if he was just 100 miles off the coast of Spain on his first trip to the Indies, which of course we know turned out to be not the Indies but the West Indies, at least that's what we called it. So just to give a quick overview of what I'm going to talk about, I want to talk about what's different, and when I say different, what I really mean is to enumerate in greater detail the considerations for the differences when you think about RTI within a early childhood context. So I want to talk about what that different world of early childhood is, the different framing that's required to see the world in a way that makes plans and implementation practices possible, and the different partners that you should be engaged with to make such an effort work. I also want to spend some time discussing the interface between RTI and special education. And finally, I'm just going to talk very briefly about what we're currently doing in Iowa and what that can tell us about necessary state systems, something that we in Iowa call Iowa's Collaboration for Kids, or we always quickly identify a little easy way to say that, and that would be C4K. So what's different? Well, I think when we talk about RTI in early childhood, we want to start to ask, so what difference does it make that it's early childhood versus some other part of the educational or social service system? And that is, how is it different than K-12, or how is it developing different than developing an RTI system across the state as opposed to just within individual programs or sectors like Head Start, child care, district pre-Ks, that sort of thing. And I would suggest there's really three things that are different. One is that early childhood is a different world, and so are our assumptions about how early childhood as a system is organized, who's in charge, how does it operate, where does it get its money. All those things are going to be different than they might be if we were asking it either on a sub-state regional basis or we were asking about K-12 versus early childhood. I think the second way is that it's different because it requires some unique framing, and really, by which I mean in some ways a different vocabulary. So response to intervention makes a number of assumptions about what education is, what instruction is, what assessment is. So we have to check our understanding of these fundamental terms and make sure that they're still accurate and that they fit in some way within the early childhood world. Third, system development is about making connections. So with a different world and different assumptions, we need to connect with a new set of friends. We need to work with different partners who we have not worked with before. So I want to spend just a minute discussing these three things and the implication for state supports for an early childhood response to intervention system. So really, what is so different about early childhood? So when we talk about RTI systems, what is different about it when it comes to the field of early childhood? Well, first, it's a more complex world because there's no single or dominant structure that defines early childhood education. The network of school districts and private schools that make up a state's typical educational system are now a loose confederation of school districts that may or may not be involved in early childhood education, depending on whether they have such programs. And then there's Head Start, a federal to local program without any formal state role. And then there's child care programs, private and religious preschools that are licensed in a variety of ways. And then there's IDEA, Individuals with Disability and Education Act funding, Title I funding, tuition-based funding, some of which go to all of these entities, some which don't, and on it goes. So with no single system or entity assumes ownership over all of this. As a result, more and more states have developed state advisory councils to at least have a single place to discuss the issues of system development. The implication of this is that without a single system of governance over all this complexity, the only way to work with others is through collaboration. So what has to happen does not come down from on high as a policy fiat. It has to come out of a place of, you are interested in this, can we get together on that sort of thing. And that leads to a second implication, which is flexibility, since system assumptions such as there is a licensed teacher in every classroom, a safe K-12 assumption may not be so definite in the early childhood work. So we can envision a fit in a myriad of contexts that we see. This is a much different world. This is the different world of early childhood. So developing RTI systems need to consider how much of that complex world will be embraced. In other words, are all those multiple settings, or just some, or just the school-based pre-K, or Head Start, or both? How will those, will they all be included in it? And how are we going to engage those various sectors? Is there any place where early childhood systems governance has a home? Can we use that in a way to build an effective structure for such a system? And finally, how does cross-agency or cross-sector planning occur in your state? So this is a different world in early childhood. Well, I think I've made that point, so I'm going to move on to the next slide. So a little bit more about this different world. One way to think about this world is, and I'm borrowing this 4 oval slide. Some of you are familiar. It's actually now morphed into 3 ovals, but at least in some of our system work, we still like to think about the 4 ovals. And this was developed by the Early Childhood Systems Working Group that was related to the Build Initiative, if any of you are familiar with that. So this different world is really has been sometimes referred to as a system of systems. And as we explain in our chapter in the book, and it is the notion of the 4 ovals that was introduced a number of years ago. And what we find out is that some of these things really need to fit together. So when we think about the RTI components and the processes, that they can really live in many systems. And I just have a couple of examples you can see on the screen. The early learning, both general education along with specialized interventions. Well, the specialized interventions may take place within family support or within the prevention oval as well. Families are both instruction and intervention agents and objects, so they can also be included because a lot of early childhood programs have a whole person or a whole child perspective, thinking about health, mental health, and nutrition systems, or all start to ask questions around availability of physical exams and immunizations and screenings and treatments, and ask the question, so where do they fit within some kind of tiered response system? So in the chapter, we talk about these key dimensions that need to be considered across these sectors or systems, however you want to envision them or name them. So the first is funding, and as mentioned earlier, there are a variety of funding sources from the federal government, at least when it's open. You know, we had a time when it isn't always open, but as well as an equal number of funding sources at state and local levels. Now, how these sources become accessible to developing RTI is important to figure out. Then in settings, we talk about the myriad of settings in which early childhood education takes place. This includes talking about where these facilities exist, what their schedule is it a full day or half day, for example, what kind of personnel are available, not just teachers or administrators, but who else might be directly responsible for administering assessments and interventions. So coaches, technical assistants, behavior and developmental specialists, school psychologists, and the like. How can these individual settings be connected to support systems and outside resources so response to intervention can be effectively implemented? Third, management. Who is overseeing the program and therefore the RTI components and processes? Program administrators, boards, directors are responsible for the organizational systems of support that ensure RTI procedures are understood and followed. Management should also be responsible for addressing 2 elements that are often ignored in developing RTI systems: diversity and family engagement. Any changes needed to support different kinds of learners, whether they be racial or ethnic minorities or dual language learners, is a dimension of response implied in the term response to intervention. Response to intervention must be about responding to differences among learners, whatever those differences may be. And parents must be co-equal partners in the pursuit of academic and developmental success. So the 4th area is professional development. Now this component hardly needs to be needs a lot of discussion, but suffice it to say that training along with coaching and implementation support are crucial for full and faithful implementation. And the variety of systems that make up the early childhood world often have to do their own training, often have their own training and technical assistance systems, so engaging them will be critically important. Administration. Now here the vagueness of the governance and the oversight of the statewide RTI system can no longer just be kicked down the road. Where is it going to live, and what kind of authority is it going to have? That really has to be answered, and the nature of the state to local relationships will also have to be defined. And finally, the key word that which you'll see will be a theme throughout this whole thing is exploration. So for all the reasons that we discussed earlier, collaboration is really at the heart of RTI. No system of RTI works well without collaboration, even at the local level. How much more at a state level is that coordination of a system of systems necessary? Now, I got to thinking about this matter of statewide systems for early childhood RTI, and because there were discussions going on about how to use an RTI framework to organize instruction and intervention at the early childhood level. And I kept asking myself, because of my position at the Head Start State Collaboration Office, so how will Head Start be involved? Well, that's my job. That's what I'm supposed to be doing. So I would be remiss if I failed to emphasize that whatever system you have or are envisioning, please ask the question, how will Head Start be involved? But of course, that can also apply to other community partners as well. In our state, they will be involved in assessments and interventions. They are teaching and making ready for school our children. So how could they not be involved? And so when we look at these functions, and I'm going to revisit each of them one more time and just discuss a little bit about what Head Start might look like if they were involved. Some of this stuff we're doing, and I would say some we're still working on. But funding. We have found out, for example, that professional development funds that could support part of RTI, and when we align the RTI framework with the school readiness outcomes, a lot of the work of Head Start could be incorporated into what we wanted to see done in RTI, namely assessment, instruction, and intervention. So working with Head Start might begin by aligning their professional development with some of the professional development needs we think are important in developing the system. In terms of settings, we looked at their variety of settings, some in church basements, some in school classrooms. And in doing so, we learned about how they use regional managers to do monitoring at a classroom level and found a perfect support role person in helping with RTI, regardless of the setting. We also connected with grantee disabilities coordinators, education coordinators, mental health coordinators, who were eager to partner in using more effective practices to accomplish their goals. We just had to make sure that they were part of the professional development and the local decision-making. In the area of management, we worked with directors early on to get them on board, and then their support made engaging mid-level and frontline staff much easier. And their ongoing support of the staff in these new roles and responsibilities was also critical. And Head Start can actually teach us something about diversity and parent engagement. So these were not hard elements to include. In the area of professional development, Head Start had to be invited to be, as did the state-based training and technical assistance system. Jim and I make a point in the book to mention that the National Center for Quality Teaching and Learning, which is part of the Head Start TA system, had a long history of involvement in early childhood RTI, and they were also great allies. So again, going through your local Head Start State Collaboration Office and the federal regional offices are your best way to align your work with what they are already doing. We have long had in Iowa a Head Start professional development system that is a three-way partnership among the Head Start State Collaboration Office, the state-based training technical assistance systems, and the State Head Start Association. So it's a key partner in helping develop training opportunities for Head Start. Our State Collaboration Office was in a great position to connect Head Start with the professional development being offered. In the area of administration, because Head Start associations are required to partner with the State Advisory Council, working with the State Advisory Council was one avenue for oversight and coordination, and made sure because that Head Start was at the decision-making table, because most states require that one of the people that has to be participating would be Head Start or the Head Start Association. So that's a little bit of what those key dimensions are that we discuss in the chapter, what they mean, and then specifically how you might take one community partner, and I'm just using Head Start because it's an example I happen to be familiar with, but obviously those same kinds of examples allowing you to think really creatively around these key dimensions for making sure that you have a collaborative system that really engages folks on a statewide level. So this new world, this different world that I'm suggesting to you really requires us to reframe what we know as RTI, and I think we do this in the chapter, is not response to intervention so much as really terrific instruction. And what we discover, much to our chagrin, is that as early childhood professionals, that maybe our instruction was never really very terrific. Or maybe it's not terrific enough. And so RTI gives us an opportunity to revisit that and to make sure that our universal Tier 1 practices are so good that most children are flourishing. And all of that work that we have done on early learning standards, that should be guiding the entire process. The early learning standards were state-driven initiatives. So how good are your standards? Do they really represent a consensus view of the early childhood professionals, state policymakers, and parents of what we earnestly desire each and every child in our state to know and be able to do? If not, revise. They are that important that if you get wrong, you get everything wrong. The early learning standards should be the basis for everything that RTI does, what we teach to children, how we know if they've acquired the skills and knowledge we want, and then what to do when they don't. Because of its emphasis on assessment, RTI encourages us to include ongoing assessment as part of the curriculum framework. And this idea should not be new to early childhood. If you consider developmentally appropriate practices or even the accreditation standards from the National Association for the Education of Young Children, Standard 4 is all about assessment. And it should include both universal screening, that's something we do for all children to see how they're doing, and progress monitoring, or sometimes called performance monitoring, to see how they are progressing. Now, I want to say a little bit about special education and reframing this discussion in light of special education. Now, sometimes we say that RTI has nothing to do with special education because we don't want folks to think that RTI is a new word for special education, or that RTI is only for children on IEPs or IFSPs, or that when a child is at the Tier 3 level of an RTI system, they're automatically referred to for special education. There is this link that you'll see, and I want to read a little bit from this document called Frameworks for Response to Intervention in Early Childhood Description and Implications, and I believe that Christine is going to put up this link for you. If not, when you revisit this webinar, you can pull up this email, or just go to NACE.org and look under their policy statements or public policy area, and they have it in there. But one of the things that this document does, and if you haven't read it, I strongly encourage you to do so, that this document was developed jointly by the Division of Early Childhood of the Council of Exceptional Children, the NAEYC, and the National Head Start Association. And in there, they discuss 4 misconceptions, and the first one is this, that RTI requires that children go through a multi-tiered system of supports prior to being referred to special education, thereby delaying and often restricting referral to special services. Then it goes on to make this comment. The overarching intention of RTI is to promote positive outcomes for all children by providing timely and effective teaching and caregiving support. Through frequent data collection, those children who are not making sufficient progress receive earlier, more intensive support that is matched to their needs. The expectation is that this additional support will help improve the child's rate of learning and narrow the gap with typical rates of development. A significant assumption is that children will not have to wait for referral to special education services, including an evaluation and diagnosis, in order to obtain additional support. And then it ends with this emphasized statement: children are not required to undergo and fail an RTI process prior to referral and evaluation for special education services. And they reference in the paper this letter from Melody Musgrove. So I thought it was so important that I went ahead and included that link as well in this presentation, because that gives one, at least the word from the U.S. Department of Education on their view about making sure that RTI is not an excuse for delaying services. So we need to be very careful to clarify these misconceptions that about the connection between RTI and special education. However, the truth is actually a little more complicated than that. They are connected. It's not that they're not the same thing, or it's not that they have nothing to do with each other. Just as we don't want anything in general education that is not also true for special education. So it's absolutely true that RTI is for all children and not just for children on IEPs and IFSPs. What we say is that RTI should be for all children and a new way of doing special education based on a reframing. Indeed, I like to think of RTI as an opportunity for us to revisit our special education practices. Now here's a couple examples of what I mean. I sort of pose it in this old paradigm, new paradigm slide. So when we think about eligibility, eligibility is usually, well, the eligible child is the one that we went through this whole process with. But in the new paradigm, the eligible child is the one who's been assessed and determined to be best served by special education services. So notice that we're really trying to see this in the broader context of where that child is, which leads to the next area of inclusion. So the old paradigm of special education referral was a way to move time-consuming, problematic, or disruptive kids out of my classroom. But the new paradigm says special education is a way to provide only to those children that need it special supports to ensure success in typical classroom settings. So we're not pulling children out, but in fact we're just providing them with the additional supports that they need to stay in the classrooms that they're currently in. And since we have this broader RTI system, it actually increases, I think, the capacity of our programs to actually do that. The old paradigm with special education addresses the needs of children with disabilities. And the new paradigm is that general education and special education address the needs of children with disabilities. Because children with disabilities don't have needs only in their areas of disabilities. They have needs like any other child. And so the more that they're participating in fully inclusive settings and are benefiting from all the general education and the special education, then I think we are truly serving them and addressing their needs as we should. The fourth idea that the LEA, the local education agency, is responsible for assessing a child's eligibility. Well, the LEA and the program, whether it be Head Start or whatever it is, work together to determine a full and individual evaluation regarding progress, discrepancy, and need, so that it's not just about what some outsider is evaluating. Now, I'm not saying that's not important, but when you have a classroom teacher who has spent several weeks or several months with a child, they may have particular insights that are very useful in that assessment process. They may have collected assessment data themselves that can also inform that process, and those things should definitely be included. Children with suspected disabilities will be addressed using an RTI process which delays indefinitely a specific determination of eligibility. Well, this is the point I was making earlier with the, this misunderstanding that, in fact, children with suspected disabilities delays receive a full and individual evaluation, and determination is established within 60 days. That's always been the law. That's always the way it needs to be. So finally, the focus then in the old paradigm was on identification and referral, whereas in a response to intervention, the right intervention to support full access to curriculum and ensure success. So it's not just this focus on, is the child in special ed, is the not child in special ed. It's really on, is the child being successful and what additional supports are needed. I hope you can hear in that this important difference when we really begin to move. Okay, I want to talk very briefly then. This is really kind of a repeat of what I've said, but I'm reframing it in a new way, and that's to begin to think about who are the partners that we might want to connect with in all of this. So clearly, I just talked about this partnership that RTI can represent between special education, general education, also Head Start, pre-K, child care, which I mentioned before, and then health, mental health, and nutrition, however those systems are put together, and family support as well. So when you think about what partners do we need to connect with and can we connect with them, this might be a useful way to think about those sectors and how we can be fully inclusive of them. And the other thing that we have tried to work very hard on as we've developed an RTI system is how do we build it on top of the initiatives that we're already doing. That this isn't just one more thing we're doing, but that in fact just becomes a way to reframe some work that we're already doing. So we try to partner, if you will, with initiatives. So the development of early learning standards, professional development development systems. How are the competencies that we identify for teachers or teaching roles or administrator roles or other roles that play an important role in RTI? How are we connecting with that? Licensing and program standards. How do those support what we want to do with RTI? And I gave the example of NAEYC's standard 4 around assessment. Well, if you look back in those, you'll see this call for assessment that can be very useful and, in fact, expected within an RTI system. Related to that are quality rating and improvement systems. And finally, something that I think a lot of education people don't pay much attention to it, and that's EPSDT, or early periodic screening, detection, and treatment. Because these are, in fact, some of the early screenings that are required, particularly for very young children, to make sure that they're growing and developing in appropriate ways. And most systems have set up some kind of EPSDT protocols and expectations, and probably, especially for Medicaid-eligible children, a way to relate those children back into the services and systems within the state that make that possible. So anyone developing a statewide RTI system should have pretty good familiarity with that. Well, I want to very quickly now, I'm running a little bit out of time here, but talk a little bit about what we have in Iowa in terms of the system. This is something I think you're all very familiar with in terms of a typical tiered system where there's a universal tier for 80 or 90% of children, and then there's this targeted tiers, small group of targeted children for like what we might call a tier 2 intervention, and then this intensive tier at the very top for 1 to 5%. And those ratios can actually become really useful because it tells us a little bit about how well we're doing. So when Iowa set this up, what they did was they really identified 5 key components: an evidence-based curriculum instruction at the universal tier, universal screening, evidence-based instructional interventions, progress monitoring data, and then finally data-based decision-making. But those are the 5 key components that need to be in place. And I share that because if you take that list and you lay it over some of the other things I was talking earlier about what are those essential components outside or within a state to build a state structure, then that can become a useful way to begin to think about it at a pretty practical level. And the other thing we did in Iowa, which I have found extremely useful, is this collaborative inquiry process. And basically we have identified these 10 questions that should happen at the program level as a way to drive real change. And so it starts with the question of, is the universal tier sufficient? So is in fact 80 to 90% of our children doing pretty well given what we're doing at the universal tier or tier 1? Is that really happening? Well, if it's not, then let's get that part fixed. And that's what questions 2, 3, 4, and 5 are really about. Then the second level is really, well, what do you do on the tier 2 and tier 3 levels? So which students, do we have a way of identifying which students need that additional support? What's the additional support they're going to be provided? How will those targeted and intensive tier options be implemented? And so this has become sort of our implementation guide geared around a set of questions that we would ask of individual programs to make sure that they're really developing internally the capacity to implement an RTI system and then to be able to respond to how children are responding to whatever tier they are and whatever programs and services that we're providing at that particular tier. So that just gives you an example of some of the ways in which we've tried to overlay a specific process onto some of the more general comments I was making earlier on. That's about as far as I'm going to go. I know Christina wanted to say a few words before we open it up for questions, so I'll let her take over at this point.
Yes, really terrific instruction. That's a really great way to think about RTI. And there's a lot of great takeaway information, so thank you very much, Tom. And just to let you know, I did send through the chat those links that Tom was mentioning in this presentation. So if you want to click on those to have easy access, I know you can't click on the links from his slide, and that has, of course, since passed. And while I'm going over this other webinar I wanted to highlight, if you have any questions, why don't you go ahead and submit them now so that I can have a little bit of time to compile them, and then we can send them over to Tom if you have any. So in the meantime, like I said, we are going to wrap up our fall webinar series next Monday with the webinar on the role of an RTI-based approach in addressing the learning needs of young dual language learners. So again, that's next Monday at 2 p.m. So go ahead and register through that link if you are interested and haven't already done so. And then our webinar series is going to continue in the spring with additional selected topics. So we will be sure to contact you about that. And the next slide, please, Tom. As thank you for joining us as part of either this webinar or all the other webinars that we've hosted, we wanted to extend a special discount on the handbook that all of these webinars stem from. So if you'd like to take advantage of a 20% discount, you can use the code RTIEC20. You have some time on that till next June. And then there's a chapter excerpt and other resources on our website if you don't, quite want to commit and you want to take a look at it. So I encourage you to use that code if you're interested. So that's all I have to say about that. And doesn't look like we have any questions from the audience. So I guess if you think of any others that we won't get to today, you can send them over to me, and I can send them over to Tom, who can share them with answers with me. And then let me see. Sorry. And then we can get you those answers. And other than that, I think that we're ready to wrap up. So on behalf of Tom and Brooks, I wanted to thank everybody for joining us today. Tom, do you have any last-minute things you'd like to add, or you pretty much covered it all?
No, just to, well, I hope so. But anyway, thank you very much, Christina, for setting this up and for the opportunity. And I hope it was useful, and people should feel free to.
Great. Well, thanks for joining us.
If you have any questions or thoughts, it's a dialogue among all of us.
Yes, his contact information was on that opening slide, so you can contact him as well. So thanks everyone for joining us, and I hope to see you on the next webinar.